Okay, let's try that again. Can we hear online? There we go. Thank you very much. So welcome everybody to our meeting of the Somerset Board, including members of the public, and we've got members online and in the room today, and a particular welcome to Dr. Ruth Taylor, who's online, interim CEO of the General Practice Support Unit as a representative of the primary care sector on the Somerset Board. And can I thank Burge Bellion for all his service, who stepped down from the board earlier this year. My name is Councillor Bill Revens. I lead Somerset Council, and it's my privilege to chair the Somerset Board. Just to remind, we are simultaneously both the Health and Wellbeing Board and the Integrated Care Partnership, and so we reduce the number of meetings by one to be able to hold by making it an advantage of our co-terminosity. So the agenda pack and papers are available via ModGov or directly from the council website. The link has been sent out to members, and in line with recommended meeting procedures, requesting that all members and officers keep their microphones off and videos, please, but please remember to turn them on when you are speaking. It helps with the background noise and anything disrupting the meeting. And when I invite someone to speak, could you clearly state who you are for the benefit of anybody who's listening to the meeting so that they can identify who is speaking? Can I also remind board members to use the chat function solely for the committee business, otherwise it is distracting. And finally, as agendas are viewed electronically, can we ask that members and officers refer to page numbers from the published agenda pack to assist those if you're looking at a particular paragraph. Housekeeping wise, there's no expected fire alarm. Should this happen, please follow Somerset Council colleagues and they will lead you to the car park at the rear of the building. If you need assistance, please make yourself known to the Democratic Services staff at that time who will assist. Have we got apologies for our absence, Rizad?
Thank you, Chair. Morning, everyone. In terms of apologies for this meeting, I've received apologies from Paul van der Heide, Councillor Smith-Roberts, Jonathan Hickman, Dr. Rima Makarem. Mel Locke has sent her apologies, but Emily Fulbrook is here attending as substitute, and Gavin Ellis from the Fire and Rescue Service has sent his apologies, but Gerald Taylor's online attending for him, Chair.
I believe we've not got Professor Michael Preston-Shute.
Correct, sorry, apology. Yeah, there's an additional apologies from agenda item number 6. The presenter, Professor Michael Shute, couldn't make that, unfortunately.
Okay, so item 6 is deferred to our next meeting. Okay, super. And our minutes from the previous meeting. Do we have any corrections, concerns, comments, observations? Not seeing anybody. Happy for me to sign those as a true and correct record. Okay, thank you. I will do so in due course. And are there any declarations of interest from anybody? Just a reminder that council members will have their membership for city, town and parish councils on the website. Okay, so we move on to public question time, and we do have a representation made by Mr. Roger Tozer relating to pharmaceutical needs assessment, which has recently been consulted on. And Mr. Tozer is in attendance, but Rizad will read out the statement, and Alison Bell, Director of Public Health, will respond.
Thank you, Chair. Dear Chair and members of the Somerset Health and Wellbeing Board, please find attached the Wellington Pharmacy Access Crisis Report, the WAPC, which serves as the formal objection and statutory challenge to the Somerset Pharmaceutical Needs Assessment, PNA, 2025 to 2028. This document asserts that the PNA contains material factual inaccuracies and critical methodological flaws regarding pharmaceutical provision within Wellington, Taunton Deane West locality. The conclusion of adequate provision is demonstrably false and is actively masking the local public health safety crisis. A summary of material errors and deficit. The attached WPAC demonstrates that the PNA fails in its statutory duty of accuracy under Regulation 6 of the NHS Pharmaceutical Services Regulations 2013 on 3 critical points. Point 1. Current capacity crisis. The PNA relies on a theoretical baseline of 4 services, but only 2 pharmacies are reliably operational. This results in an extreme and unacceptable 13,500 to 1 people per pharmacy ratio. The P&A continues to list the permanently closed Boots Medical Centre branch since 2024 and the intermittently closed Chahoots Pharmacy, whose service failure has been subject to NHS Regulation 25 removal procedures. Point 2, unverified data. Extensive textual comparison confirms that over half the Wellington locality entry was copied verbatim from the previous P&A 22 to 25 with only cosmetic edits. This practice undermines the statutory fitness of the document. Point 3, future demand failure. The P&A severely understates the future demand. It records only 1,800 home increase when confirmed developments at Jurston Fields and Orchard Grove now exceed 3,000 dwellings. This omission conflicts with a binding Supreme Court ruling October 2025. Formal demand for action. Given the clear evidence of material inaccuracy and unmanageable burden placed on the remaining 2 services, we formally request that Somerset Health and Wellbeing Board and ICB take the following urgent statutory action. Formally acknowledge the service crisis and unacceptable 13,500 to 1 people per pharmacy ratio. Issue an immediate supplementary statement to the P&A correcting the service baseline and removing delisted contractors. Commission a partial review for the Wellington locality, TA21. Commit to a plan to deliver at least 3 new pharmacies to restore safe, sustainable provision. Failure to address these critical points risks leaving thousands of residents without reliable access to essential medicines. We expect a formal response and a timetable for corrective action without delay. Sincerely, Roger Tozier, Wellington resident and author of the Wellington Pharmacy Access Crisis Report.
Okay, thank you very much, Mr. Totem. Thank you for reading that out. Can I invite Alison Bell, Director of Public Health, to provide a response?
Yeah, good morning, Mr. Tozer. Nice to meet you, and thank you for your question. I'm going to read a response and I can share that with you. The pharmaceutical needs assessment is a process that's nationally prescribed, and it assesses if there's physically a pharmacy within a designated drive time for centres of population. This is a tool designed to inform NHS Integrated Care Board's response to applications for new pharmacy providers based on physical gaps in pharmacy locations, not a patient satisfaction tool. The P&A, the Pharmaceutical Needs Assessment, can only comment on pharmacies' locations and is required to reflect all pharmacies as open unless formal notification of a closure is given. If there has not been a formal notification of closure and a pharmacy is included in the list of providers, then we're obliged to include it in that pharmaceutical needs assessment. There is no quality assessment of services offered, or if there have been breaches, temporary closures or lack of staff as part of this nationally prescribed process. And we're aware that such breaches affect people's access to their local pharmacies. The scope is nationally defined and we don't have any flexibility about that. However, I have raised these concerns with our Regional Director of Public Health because I, like you, believe that the process needs to be updated. Pharmacies have gone from being simply a dispensing service to actually a really critical point of care for all of us. And many of our population actually rely on them in emergencies, such as for emergency hormonal contraception or for opiate substitution therapy. So I've been working with Sheila Meldrum from the ICB to make sure that where we're seeing temporary closures, the quality aspect, we're making sure that no harm is done. That is a separate process to the pharmaceutical needs assessment, which is just assessing if there's a pharmacy physically in a location. So the Somerset Board is not responsible for actually the delivery of new pharmacies, and the P&A is unable to comment on contractual issues such as temporary closures. I stand by the work of the Somerset Council Public Health Team that according to the national definition, there is no physical pharmacy gap in the Wellington area, as there are 2 pharmacies still functioning within Wellington. Any concerns about the existing pharmacy services do need to be relayed to my colleagues at the ICB, and I have copied the relevant pharmacy commissioner at the ICB into this question that you raised. And I would commend the work that Healthwatch, one of our Somerset Board colleagues, has done around the access issues that patients are experiencing related to pharmacy. The last bit I would close with is that there may be similarities between the previous P&A and the current P&A, but it wasn't copied verbatim. It was reassessed. I would thank you for your question, and we don't believe that we need to redo the P&A at this time, but we do keep it under constant review because we know that the pharmacy landscape is changing constantly, and there is a provider that provides 6 or 8 pharmacies in Somerset which is experiencing challenges at the moment, and I work with Sheila to make sure patients do have access to services that they need. So thank you.
Okay, thank you very much, Alison, for the response, and just confirming that there'll be a full written response as well for you. And thank you very much for raising that issue. I know it, particularly as you were seen in the national news. I believe the Wellington one isn't one of the ones that's been taken over by Allied. It's my recollection, but I know that MP and councillors are on the case as well with this, and hopefully we can get the situations resolved as well, where the pharmaceutical needs assessment isn't the right tool to do that. Okay, thank you. Okay, so we move on to agenda item 5, and that is the Somerset Board Action Tracker, and invite Rizard to update on the action since the last meeting.
Thank you, Chair. So at the last meeting, it was reflected that we didn't really have an actions tracker in process for the board. So we've since created one that's been shared with papers. So I won't run on the closed actions or completed ones, if I may. That's there for the board to view and comment on. And please do come back to me if there's any corrections that you'd want to make to any of those actions that are listed there. We have 3 that are currently still in progress. There's one sat with myself in terms of better links with the housing and health. So there was an action with me to discuss how the Homelessness Reduction Board should be better linked into this meeting. The Homelessness Reduction Board itself has undergone a restructuring and a renaming. It's now the Strategic Homelessness Board, I believe. They've also got new working groups that are being established underneath it as well. So from my perspective, I'm continuing to liaise with them and understand better how to link them into this board and when items need to come forward from that, but also understand better how we might be able to feed into them and their work group as well and their activity. In terms of a secondary item that's still in progress, David McClay's got one around the integrated healthcare strategy outcomes and metrics. This is going to align quite closely with the development of a dashboard for this board moving forward, and there's going to be an expectation on an update on the joint forward plan due to come to the board in March as well on how all of this activity aligns really, and how we more closely link our outcomes and metrics with those, both just within here for Somerset Board and our vision and measures, but also with the ICB as well. And then in terms of the third item that's still open, Duncan flagged at the last meeting that there was a piece of work that's coming forward from the National Association of Primary Care that himself and Peter Lewis and Ruth Taylor, I believe, are both online this morning. We're working on. That's still sort of coming through, and we may have an item in the future for the board, but I'll hand over to Duncan for a further update on that if I can, Chair.
Thank you, Chairman. I'm very happy if Peter or Ruth wants to jump in as well. So the 3 of us have co-sponsored a piece of work which quite a few people have contributed towards to get the National Association of Primary Care to pull together a report about what the 10-year NHS plan might mean in Somerset, alongside what our ambitions for Somerset were in terms of particularly looking at neighbourhoods, place, how we actually want to deliver in the future. We felt it was quite important we actually started to pull something together, because obviously as we move to the new ICB clustering arrangements, we'll be one of many places in a new cluster rather than have a one-to-one relationship. So we probably need to do a little bit of work to sharpen up effectively our vision of place, because that will become more of a contested space, I'm guessing, in the future, with more partners having different visions for their places and a cluster board having to make decisions about how we make investments and how we actually resource things. So we've got, I think it was just on Thursday or Friday last week, we got the slide deck through, etc. Our next meeting isn't until March, so we will have to do something with the report between now and then, but we'll work out a process between Peter and Ruth and myself about how we're actually launching that report in a public sense, and actually how we're going to share it. It's not a report that says, you know, here, do this thing and then it's all sorted. It gives us a lot of language and a lot of thinking about how what we've been talking about locally, collectively for a while now fits in with a 10-year plan. But it also suggests that I think it's mainly two things we should do. One is develop our plan in more detail. It doesn't give us a map of what places should look like. It's not that level of granularity. It's about thinking that should underpin the work we need to do to decide what's a neighbourhood, how do we roll a neighbourhood out, how we're resourcing a neighbourhood, what will it physically look like for local people in terms of the healthcare landscape in that place, how will they access services collectively. And it also addresses what we might need to be thinking about as part of that conversation in terms of things such as the shifts from hospital to community care, etc. So there's a huge amount in it, but it suggests that we need to develop a development plan for the things we want to do, and also a development plan effectively for our partnerships and relationships to make sure we got them in the right place to deliver those things. So I don't know if Peter or Ruth wanted to come in because Sarah's co-sponsor this alongside myself, but I don't know if they were forewarned we might be saying that. So
I haven't got anything else to add. Thank you, Duncan. That was an excellent summary. Thank you.
Thank you, Ruth. Peter, anything to add?
No, it's a good summary from Duncan. I think the really important thing is what we do with it. As Duncan said, it's not a roadmap of actions we need to take, but it's a very helpful piece of work which helps underpin the work we now need to do in the future. So yeah, we need to come back with it, but we need to plan that clearly.
Thank you both. Sarah.
Yeah, I just wanted to mention item 5 about homelessness reduction. And I just want to bring to everybody's attention, which you already know, I'm sure, the serious crisis we have of homelessness across the country, but in Somerset in particular. We simply do not have enough houses for people, and I've lost count of the number of times I have said to people, I don't have a magic wand here. We cannot produce a house where there isn't a house, and we can't find temporary accommodation close to where you live because we don't have any temporary accommodation close to where you live. So I just want people to be aware, because it's such an important thing for people to have a home that they can rely on for their health and well-being, for their children, for their whole lives. And I really emphasise this problem that we've got. Despite the fact it's no longer going to be called the Homelessness Reduction Board, we are concentrating on reducing homelessness. We are bringing forward different strategies to try and access homes and try and help people in the difficult situation they are in, keep them in their homes for longer if possible after talking to landlords. But I beg of anybody who's got property that they think might be useful to the council to convert for homelessness, to convert into flats, to come forward with that property, because we will be able to use it and we will be able to find tenants. And it's just so important for everybody in this county to know that. I've had people at parish council say to me, oh, well, the reason you want so many more houses is because we've got so many people coming to the country. And I've said, no, we have a housing crisis now. We do not have enough places for our people to live. And I just wanted to emphasise that because it's really important. I'm glad it's on the action track of how we relate back to this committee. But I'm also just want people to know that we are really concerned about this and it's not getting better at the moment.
Absolutely, and yeah, just to add that we need people to come to this country in order for our health and care sectors to be able to operate as well. It's interlinked in multiple ways. Lisa.
Thank you. I wanted to raise actually on a slight same content, but in terms of how the homelessness work reports in, there is an anomaly. So reporting into this board and also into the Adult Safeguarding Board, there is a gap there when we consider our sort of peer vulnerability work. And in terms of action-led outcomes, I don't think this is the place for it to report into. Ultimately, yes, but to drive work, no. And there is a gap in our structure. It is something that we've highlighted. It is something that we're working on, but I do think that we need to track that action and bring it back, hear what our proposals are, because it sits on its own and yet its work completely underpins vulnerability work in all the other boards.
Duncan, did you want to respond to that point? Okay, Heather.
I'm kind of moving. I don't mean to be obtuse about it, but I think also one of the things I've always been interested in. You're absolutely right, Sarah, what you're saying about the not enough properties, and I think because most of the properties that are built in Somerset are built through developer work. So I just wanted to make sure that whether the Strategic Housing Board, and it's got a different name now, if that's one of the kind of methods by which the council's local development plan, the local plan, actually feeds in. into that wider thing about population health. So I just wanted to make sure we didn't lose it in any room like this. I don't want us to lose the impact of our local plan. I know you'll be thinking that, Sarah, but just for others in the room to know that's a really key part of it, because it'll be our decision strategically about where we want houses and where we want homes and infrastructure. Sorry, it's slightly off topic from what you were going to say, I think, Duncan.
I can pick up two things if I can, Chair. First one, just Lisa's point. We did agree, I'm going to say the end of last year, beginning of this year, that we would do some work within our safeguarding partnerships to try and pull together a central business function. So particularly in the community safety partnership, the adults safeguarding and the children's safeguarding arrangements, there's an issue, I think, about there's too much that hides actually, are we tracking through vulnerability? So we've got lots of groups that are about process, and the homelessness reduction side is starting to feed into that as well. If we're not careful as professionals, we end up in a position where we're actually passing issues from one group to another, not actually resolving them. So there's something about streamlining those arrangements, and there's something about pulling together a central business function so we can actually start to understand when we're talking about an individual or a group of people, actually that's the same group here who are also homeless, also at risk of county lines, also at risk of. And there is a risk right now that we don't track those as being the same person or same people. We actually think they're all different and we deal with them through different mechanisms. So there is a piece of work which I think is fair to say we struggle to get going. I know Lisa's pushed it very hard and continues to do so. But particularly within the council, we just need to pick up and actually give support to some of our colleagues who are leading that work and just try and get that over the line. So that's probably a worthwhile thing to keep an eye on here and just keep asking for progress now and again, if that's okay.
Yeah, thanks, Bill. And I know we're not looking at the Safeguarding Adults Board report today, but it was articulated in that report that actually for complex adults, we don't have the right panel in place that can make decisions that will influence outcomes. So I personally think we shouldn't wait for this report. I was disappointed that because one person wasn't available, we've bumped it off the agenda. But I think we should act and say, if that gap is present in our system, and this time of year is the worst time of year to be homeless, isn't it? We should actually step up and step into that space and try and find a solution.
I couldn't agree more. Thank you, and everything that Duncan was saying about this piece. As I was reading through the two reports coming here, and of course having been involved obviously very closely in the report that went the last time, I'm thinking we shouldn't be having separate reports for things. We should actually do things together and not just look at, it's nice to have the reports and that's great and that we have to do them, but what are the themes? And those themes shout out as very similar across each of the three safeguarding reports or areas of activity. So yeah, I think if we can look at it differently, I mean, by all means we can look at the report today without Michael being here, but I think we just need to stop thinking in little buckets and start thinking about overall vulnerability and reporting that way, especially here, because here should be where we can make the strategic decisions and the strategic unblock things here, because the work gets done elsewhere, as Lisa says.
Okay, so just following on that discussion on that point, I appreciate we don't have the adult safeguarding report, but can we add something to the action tracker that is a work in progress to be able to deliver that?
If Emily's happy as a adult social care, I think that's a sensible input from Alison.
And everyone's nodding with happiness. So that's good. Okay, if we can add that to the action tracker, that would be superb. Any other comments on that agenda item? Can I just a small one from me? Do we have a due date for the forward plan, Duncan?
Sorry, the forward plan for the adults.
Yeah.
I'll ask a reason on that.
I don't know. We've only got one meeting absolutely scheduled in next year so far, which is March, and then we're still clarifying what the dates will be. Oh, sorry. Apologies. So we only have one meeting scheduled in so far for next year in terms of the end of March. We've yet to clarify what the dates will be moving forward. So I'm developing a forward plan, which we'll touch on a little bit later, where we'll include these items. Where there needs to be discussion in between what was the formal meetings previously, where we're looking as to whether we can facilitate that as well. So we must have additional meetings, but in a much leaner way, I suppose is the best way of putting it.
So just picking up on that point, then is it worthwhile maybe looking at an informal meeting, maybe some point in January, to pick up the work that we just said we'll take as an action from the adults report already. But also, if I'm thinking if people are happy, we could maybe ask colleagues who are looking at the safeguarding arrangements collectively to see if they could maybe come and give us a bit of a presentation, which might give a bit more focus and umph to the proposals. If we had that as an informal meeting, that would give everyone a notice, I'd hope, and hopefully then we should have some arrangement in place for the complex cases as well.
Alison, did you want to speak?
Yeah, just for detail. So it's on page 48 of the adults report and section 9. So the detail there, it's written in that report, so we can start maybe even setting up before we wait to the January meeting.
I think everyone's nodding away. So yeah, let's crack on. Okay. And just to note the 10 closed items there, and to thank colleagues for their contribution and actions to get those over the line. Okay, so as mentioned, we're not directly looking at item 6 on the agenda as we don't have the presenter, but we have as in the last item picked up one of the action points that result with that. So moving on to agenda item 7, which is the Somerset Safeguarding Children's Partnership annual report. I understand Claire online is presenting. Looking forward to Claire. Yes, she's appearing. That's good. It's always one of those nerve-wracking moments as the presenter online. Are they actually there? That's brilliant. Over to you, Claire.
So I wasn't going to present the report because the report I think is self-explanatory in terms of people being able to read it. I did have just one slide. I don't know if that can go up on the screen or if I need to share it, where what I thought might be helpful is to look at the wicked issues in terms of those issues that are affecting children's wellbeing and safeguarding in Somerset, and how interconnected they are across the whole system. And the fact that we all need to work together to try and work through solutions for these issues to improve children's wellbeing and safeguarding. Is it possible to share that slide, or do I need to do it?
It's on the way.
Okay.
Just, it's the wonders of technology. It will be with us shortly. Is it imminent?
It should be.
I could start because I can remember what the first point was.
There it is.
Okay, brilliant. So if you just move to that slide, okay. So the things we're worried about for children in Somerset reflect quite a lot of things that people are worried about nationally for children in terms of their well-being and key issues in relation to safeguarding. So I've started off with the impact of child poverty, because I think that's a really critical issue for children across the country. We've heard a lot about child poverty in the news, and I'm sure in the budget tomorrow there will be a lot of information about child poverty and potentially what the government's going to do about it. There's some really alarming statistics around child poverty in this country. So since 2010, there has been a significant rise in the number of children living in child poverty, a rise of nearly 1 million children. And that means that at the moment there are about 4.5 million children in the country living in poverty. This is data from 2024. That's about 31% of the child population. I can't see that that's any different necessarily in Somerset. We don't have any very clear data about the specific of Somerset, but we are doing some audits on individual children and families to look at the impact of poverty on children's lives in Somerset. So when you think about the things that have happened nationally in the last few years, so the benefit cap, the 2-child limit that was introduced in 2017 might be removed tomorrow, we are hopeful. They're among key drivers for that change more recently. And of course, those changes disproportionately affect single parent families and also larger families. And the impact of that, and the wider impact, which was what makes poverty such a wicked issue, is there's a real correlation between poverty, poor mental health in terms of adults and children, increased school absence, which is logical because parents don't have the money for school uniforms, school meals. Getting to school sometimes is difficult. And as we already talked about homelessness, it also obviously increases the risk of homelessness of families. So that has been exacerbated. All those issues have also been exacerbated by the pandemic. And since the pandemic, there's been a 78% increase in households nationally at risk of homelessness and a tripling of what we would describe as severe school absence. So severe school absence is when children are attending school less than 50% of the time. We have done well in Somerset in terms of improving school attendance for the majority of children. So we are now slightly above the national average across all key stages, but we're not back to where we were before the pandemic, and most places in the country are not. And that work in Somerset has been led through the Multi-Academy Trust Chief Execs Group and Cabot Learning Federation's work as the attendance hub for the South West, working with peers in Somerset to try and improve school attendance, which has had an impact and appears to be sustained over the last 12 months. School is obviously a really protective factor for children. It protects children from a lot of safeguarding and wellbeing risks. So the fact that school attendance is a concern in Somerset is obviously a really big issue in relation to children's safeguarding. We know there are increased numbers of families requesting education healthcare plan assessments for children. There are really significant rises locally that reflect the national picture, over 30% increase in the last 12 months. And that appears to be, anecdotally, from what everybody's saying around the country, that since the government announced national SEND reforms, and those have been more and more delayed, families and schools have become more and more anxious about what those SEND reforms are going to say, whether they're going to reduce the numbers of EHCPs. We have no idea what those SEND reforms are going to say, by the way, and are applying a greater number for education healthcare plans for children. That, in terms of those children being identified as having special educational needs, makes those children, bizarrely, more vulnerable. So more children who have special education needs and disabilities are suspended or excluded from school. So the exclusion rate in Somerset is high, and 65% of children who are excluded from school have a special educational need or disability. So the fact that you've got children who are vulnerable already, have a plan that is meant to support them and keep them safer and better supported in school, that doesn't seem to be necessarily played out and is an area of huge concern. We also know that in terms of older children, when you start to go through the system, we have increasing numbers of children in Somerset at risk or victims of criminal exploitation, which I can see Lisa Simpson is here. She'll probably be able to support me here. We can see more children. It is rising, but rising fairly gradually. But violent crime, serious youth violence is a really big issue in Somerset. It's also a key factor in children in their teens entering the care system. So when we look at data, and we look at data every 6 months in terms of children coming into care in the previous 6 months, over 50% of children coming into care in their 10 to 15-year-old age group have lack of education or part-time timetables as a key factor in their family saying, we cannot manage our child, or this child cannot stay at home at the moment. That's logical when you think about it. If you've got families that are struggling financially, struggling with difficult teenage behaviour, when their child is no longer in school or in school part-time, it might mean a parent can't work, which pulls the family into greater poverty, or that parent has to work and the child is left to their own devices during the school day. They might be walking around the streets, they might be getting into relationships or meeting people that you wouldn't want them to meet. That makes them much more vulnerable to being a victim of criminal exploitation. Criminal exploitation, as well, as we all know, is also quite financially lucrative for young people because they are pulled into a world of exploitation. It's not unusual for young people who are drug running to be given quite significant amounts of money as well as goods, which if you're in a family in poverty, young people will say, I don't really want to be doing this, but it is actually helping my mum to be able to feed us all and for us to stay in our house. It's a really huge issue in Somerset, and we are a bit of a centre for criminal exploitation in the southwest because, bizarrely, of our good transport links. There's also a continuing spike in Somerset in national data for young people who are accessing A&E for self-harm. That's been a long-term spike, which we as a system have not been able to resolve. It implies that we have significant numbers of young people who are really struggling with their mental health and their self-esteem, which although we have a lot of resource across the system in health and in social care and in education, to be fair, in supporting young people's mental health and well-being, that spike continues to be there year after year. So it's not having the effect we wanted to. The impact of all those issues are more and more children are needing early help, education, health and social care support above what we would see as the sort of universal services norm. That's placing a huge demand on all services across Somerset. That demand is rising all the time. Interestingly, it's probably a whole population issue because the demand is also rising in adult social care to the same degree. And there is something here about how we work together as a system to try and understand what it is that's causing these issues for children in terms of our concerns for their safety and their well-being, and what it is that we do together differently to try and support their well-being and their safeguarding better. There are some national initiatives at the moment which we are working with to try and improve these issues. We won't see the impact of that, I think, for a couple of years, but it will be interesting to see the impact of it. So most people probably will remember Sure Start Children's Centres, which were part of a previous government's early help initiatives. Most of those, well, in Somerset, all those are closed and have all gone. And there's a new initiative called Family Hubs, which we are required to be part of. And we are very enthusiastic about being part of that, and the focus on that is the early years, so is working with maternity, health visiting, early years providers up to receptions level in school to try and identify children early who have SEND needs, social needs and learning needs, so that we can actually put that support in as a system really early in that child's life to support that family, to try and make sure that that child can go into their local school with their peers with the right level of support and get the right level of social support so they can stay at home and thrive at home and at school. And there's also an initiative called the Families First Partnership, which is a partnership again across the system, which is looking at putting more resource into local areas, so decentralising services for children across all systems in terms of social care, health and community support services, to make sure that children have access, initially children, then the wider system, already adults are involved in this as well, to make sure that children and families can access somebody locally face to face when they need to, as well as a digital offer to try and support people to access support as early as possible, ask for help when they need it with people that they know, because these people are in their local community, and to be able to work with those people in a sort of safe environment and feel that they have confidence in those people, that they're going to get the help that they need when they need it, rather than when the resource is available. So we have started that work. Connect Somerset is the foundation of that in children's services. We have integrated our education services in terms of attendance workers with our early help services to provide a homeschool sort of holistic response to children. And that will support some of these issues that we're worried about in trying to reduce some of these issues, but it's not enough. There needs to be further work across the system. And I think if I was asked which of the areas that I would want the board to focus on or to ask for more information on, education is a really key protective factor. We haven't got that right. Getting education right from pre-birth right through early years into school and through the school system up to FE and adulthood, and also child poverty. The impact of child poverty is absolutely devastating on every aspect of children and families' lives. I'm not sure we understand enough about it and how we support families to get out of that situation, to give their children a better standard of life and to be able to live safely in their family environment. I'm happy to take any questions.
Thank you, Claire. Lots there. So just looking around if anyone's got any questions. I'm quite happy to go first, but Heather's there already. Well done, Heather.
Thank you. It's these are the things that keep you up at night. I mean, they really are, they're wicked issues, and they're wicked issues for all of us. And oddly enough, as Claire was speaking, when she was starting to say, which ones would I go for first? It was poverty and education that came to my mind as well. So I guess my question really is more for us about how can we as a board be making this difference to this? We're all the right people in the room for this. So because there's two things. One is about addressing the current problem, which is one thing which we have to do together, and the other one is about trying to prevent it. So, and as typically, I think with lots of us, when we have these wicked issues, we already are massively overstretched in dealing with what's in our system and in our bag of work, but at the same time as dealing with that which is almost crisis or sub-crisis or about to be crisis for those people involved, for the people involved. We also have to be looking ahead as well, or earlier upstream. So we have to have both things. One is reacting incredibly well across the system, and the other one is what can we do differently to stop people coming into this. So it's a bit of a rhetorical question, but I really think this is bang on for this group of people, but I don't quite know what the methodology is about how we take it forward. But I'd love to know what people thought about it. I think people might often think that the child poverty thing is absolutely right. We're thinking about population health here all the time. Education might feel a little bit more niche, but if we don't all work towards the education piece and do everything else that keeps children in education, and that is for us around here, then we will still have these issues about children falling into all of the wrong activities and situations. So I just love us to be able to, I don't know, I know we have more and more meetings, but I think it would be great if this could be something that we really focus on. But I'm not quite sure how we do it.
Thank you, Heather. Duncan?
Not dissimilar to what Heather was going to say, actually. So I think, as a board, if we're the ultimate group for Somerset saying, what do we need to address, where do we need to get to, it's not going to be all operational issues. Hopefully it's not going to be service specific issues. It is those wicked issues. And I would have to say poverty keeps coming back up as a driver of so many issues across all of our communities. Whether it's driving homelessness, whether it's driving criminality, whether it's driving vulnerability, in all sorts of ways, poverty seems to be a really significant issue that is growing in Somerset. Picking up Heather's point about what do we do about that, I think that's the $64 probably billion question with inflation now. And there aren't easy answers. If there were, we'd have done it already. But I think the one thing we don't do very well is actually start to say, so what data do we all have already? Where do we see the data? I don't just mean about numbers in terms of percentages of population, but actually what's poverty driving? Where have we got services who are saying, actually, we're receiving demand here because poverty is a factor in the reason that this group, this individual is coming to us for a service? And actually, do we start to understand that? Do we start to join it up? Because I suspect the impacts across the council, we could try and track, and we'd fail to get all of them, but we get some of them. But if we do that as a system, I'm not sure we have got that level of information easily available to all of us. So maybe the first stage of what do we do is a bit of data trawl and some analysis, and commission some people much cleverer than me to actually start to say, what does that really look like and what does it drive?
Thank you. I've got Angela and then Bernie. Angela?
Thank you. Good morning, everybody. Really delighted that we're all focusing on these wicked issues, and a couple of points. I'm also a Connect champion, by the way, so I'm really pleased to hear that that programme is recognised as a valuable way of preventing in the future. Just to add that the Transform Family view has real potential for us in Somerset to bring the wider voluntary community, faith, social enterprise sector into the system, which is important, so that we have a bigger, richer picture of all of the work we're doing with the families and children and young people in them. And the second point for me, I just wanted to ask Claire, within education being a protective factor, do we include youth work and that wider piece for children and young people? Because I know in Somerset we've had a bit of a spiky profile around our youth provision. The Somerset Youth Alliance is a VCFSE group, and they are working extremely well together now and going from strength to strength. But I wondered what that plan includes around education as a protective factor from the perspective of youth work.
So this is specifically about children being in school, in terms of the protective factor of education, because we know that children being in school has so many benefits in terms of routine, people have keeping their eyes on them, having peer support, having adults who will listen, and enabling them to progress their life, basically, because they've got a better education. I mean, youth work is amazing. I have no problem with youth work at all. Clearly, the council no longer has youth workers. It was one of the things that went when we had to reduce statutory, anything that was non-statutory quite a while ago now. And I can see that the youth work that a lot of town and parish councils are starting to commission is really effective. I'd be very keen to look at that with the Youth Work Alliance to make sure that that it is in the right place and doing the things that children and families need, from the perspective of people who are in the community and understanding what is required in terms of youth work in local communities. But it would be great to link those youth workers into localities, and that whole sort of early help piece in every area. That would be brilliant. Yeah.
Yeah, thank you for that, Angela. And yeah, absolutely, Claire. I think it also kind of went to fund a freezing council tax as well, and to appreciate the amazing work that our city, town and parish council colleagues have done to step into that area around supporting the VCSFE sector to provide youth work in that absence. Bernie?
Thank you. Yeah, really interesting report, but perhaps interesting for all the wrong reasons, and in many ways really quite disturbing. Essentially, I spent most of my clinical career working with children, and I've always been somebody who has tried to advocate for making sure that we pay enough attention to children. But actually, much of what we're hearing here is a contextual set of issues, of which the children, in many ways, are the sort of the barometric demonstration of the impact. And I mean, Heather, I think you're absolutely right in terms of what we need to do to try to get ahead of some of this. There is something about every child and young person being tomorrow's parent, and there is a risk that if we look at, as much as I said I want to advocate for children in a way being special, there's something about, unless we start looking at childhood as a genuine part of the continuum of life and our communities, and how that then sets itself out for success or otherwise, I think we'd be missing a trick. So I don't think that's an answer to anything, but it's just a particular sort of perspective and observation of perhaps how we need to, if we're going to get ahead of this, we need to start looking at the environment within which children grow up, the way in which we're equipping young people to be parents, how we support them in those early phases, etc., etc. None of it's easy, but I just thought I'd just offer that.
Thank you. I've got Alison, then Catherine.
Yeah, thanks, Claire. It's quite sobering, isn't it? In leafy Somerset, where you start seeing real tangible impacts of poverty. So I've got three things, I think, really. The first is really similar to Bernie. The welfare state was designed around brief interventions for single problems, and then you went back home and you were fixed. And that model doesn't work anymore, because our families and our communities are really complex. And I'm really struck by reading the adults report and then reading the children's report and going, just got people living with a lot of complexity, and we need to stop treating them as a child or an adult. They're a unit. So I think there is something about how we join that up and manage complexity. It's exactly what we were saying about homelessness earlier, isn't it? It feels like we haven't got that right as a system about how we manage, sorry, phone's going, complex people. And so I think that challenge we need to grasp. And so that's the first point. The second point is, I agree with you, Claire. We talked about this yesterday. Education, single biggest protective factor for health and wellbeing outcomes. But we have an education strategy, and we have a partnership delivering that. So am I hearing you're not getting the support in children's services to deliver that? And if you're not, what can we do to help? That's the second thing. And the third thing is child poverty. I met Frank Field years ago. Very inspirational guy. And there's a set of evidence-based things you can do to mitigate the impact of child poverty. And what we probably need to do is go, this is what the evidence says. Are we doing it? We can't change national policy. We can't change people's income. But there's probably a quick audit we can do about, are we auto-enrolling people on free school meals? Is everyone getting their childcare vouchers? And so I think we could do that. And so I'd make that nomination that we do a quick stock take of what interventions we've got for child poverty to make sure we're doing the things that work.
So if I just want, sorry.
Yeah, Claire, did you want to come back on those points?
Yeah, so I was just going to, I agree with what Alison's saying. And in terms of the education issues, I think we are getting the support we need in terms of trying to improve school attendance and trying to reduce exclusions. But there are systemic issues in the way that schools are funded, where they feel unable to support some of these children, in the way that some of these children who are less than 50% attenders at school disappear from the system. So some of it is also about the wider system being interested in education. So, you know, and promoting education. I think you can see since the pandemic, the sort of family or parental view of education is now very, very variable. Some parents don't value children going to school as much as they did before. And that is a real worry in terms of children attending school, because if your parents don't tell you to go and insist you go, you're not likely to, are you? So having that whole piece around everybody in the system who meets with children, talking to them about school, about that it's a really good thing to be in school. Are you in school? If you're not in school, is there anything that anybody could do to help you get to school? What are the issues? Making sure that schools know that people know if children are not in school, particularly in terms of the local areas that connect Somerset and the locality working. It's about a whole system approach to education is the best thing for children for all the reasons in terms of lifelong outcomes, and having a whole system approach to just nudging that constantly as this is what we need to do for children. They should be in school, they should be learning. It's going to actually improve their lives and their chances in life. I don't think the other things were statements, I think, rather than questions, but if I've got that wrong, Alison, correct me.
Sorry about that. Microphone is not playing correctly. I totally lost my train of thought. That's totally interrupted me. Thank you, Alison. Thank you for the response, Claire. And then on to Catherine.
Thank you. Oh, sorry. Thank you. I just wanted to kind of follow up on the point about the Youth Alliance, because as described, it's been a really rocky period for youth organisations, and I think there's been a lot of work over the last year, and the point I was really going to make was I think there's a real appetite amongst the youth organisations to start having these system conversations as well. So we've run a couple of drop-ins where organisations are reflecting exactly what you've talked about here, Claire, around the kind of complexity, the level of need. And there's a real appetite, as I say, amongst those organisations to think really differently about the provision that they're offering as well, recognising that the model, as Alison mentioned, you know, that the old model isn't necessarily what we need going forwards. So we've got an event, just a bit of a shout out really, on Monday on the 1st of December, we've got 50 youth organisations at an event, and the kind of focus for the very short term is very much on sustainability of those organisations. That is our focus. But I think quite quickly, once we've done some work around that, it is going to be around what are the thorny issues, what are these big conversations, how can we enable those youth work organisations to be part of these conversations and part of the solutions so that we can join things up more effectively. So as I say, it was really just to kind of make it really clear that there's a real appetite amongst those organisations to be part of that solution. So anything we can do to kind of convene and connect some of those conversations, we're really happy to help with that. And I can send, after this meeting, if it's helpful, I can circulate some of the information about the work that the Youth Alliance are doing, just so that people are up to date. Because as I say, I think there's such a lot of brilliant work going on, and I think what we need to do is connect it more effectively so that we can really, you know, have the very best chance of supporting these young people that we're talking about.
Okay, Heather?
Hi, thank you, and thank you, Catherine, for that. I think what's occurring to me as listening to this is we've got lots of work on this at different levels, which is all our day-to-day work as the Somerset board. We've got the thing about they've got the national system, which makes, you know, the systemic issue, which actually makes poverty unfortunately a reality, because you know you can pull different levers as a government and child poverty will go down, pull other levers and it goes back up, and we've been in a going back up numbers of child poverty for such a time. So I think there's something about what we lobby for and what we do, what we say in different rooms we find ourselves in that can have an impact nationally. I think there's the strategic bit across our area and right down as well to kind of community, because it's been mentioned, Angela mentioned it, things like you know the Connect Somerset, but also right now we have a nationally driven but locally appreciated drive to do things locally. So that's both for health and that's also for ourselves. We also want to reach out to our communities as a council, all kinds of reasons. We want to keep that connection locally. So I think, and some of it solving some of our problems, as Catherine was saying, with the youth, for instance. So we're going to be having to work on 3 different levels. And I think an audit was mentioned a minute ago. There's something about doing like a strengths analysis. We got data, but it's a strengths analysis. What have we already got? What are we already trying to do? Trying to find the gaps and the overlaps, so that at least we can start putting some things in place to do that preventative stuff that Bernie was saying about, you know, it's because getting ahead and getting up front, and as Alison was saying, getting up front is so important. And lots of us are trying to do it, but we all seem to be doing it in different ways. So if we just cluster it all together so we know what we're heading for. I think I can feel like a conversation where we're not doing it through microphones and choreographed and just, you know, getting a few of us together to actually do our work in our own areas and bring it back and say, these are all the things we're doing. Let's make sure we're all going in the same direction. And I think that a phrase I heard a while ago, which is what starts somewhere and go everywhere, you know, just start doing some stuff strategically though, so we're not just running around.
Yeah, I don't want to speak on behalf of Acute Trust colleagues, but I just wanted to share some information of some work that many partners around the table are involved with. So there's going to be an event the second week of December, hosted by Somerset Foundation Trust, but co-facilitated by the ICB, by Children's Services, Public Health, and many other partners. And exactly that, we are trying to look at how we're going to work differently together for children in Somerset. So I didn't want people to set something up not knowing that that was going ahead.
Okay, thank you. Just a couple of points from me. First of all, really excited to hear about the Family Hub and Family First and initiatives and understanding how that's fitting in with our locality work that we're doing in partnership between ourselves and health. That's really encouraging. I noticed the commentary around the SEND white paper and the delay there and the unforeseen consequence of the uptick in demand for EHCP applications. Yeah, I'm aware that we've got sight of that as a local authority, and we know that there are capacity issues with us. I'm also worried about the capacity issues within the health service as well to respond to that, because I do know that those pathways are sometimes problematic for families and parents, and just making sure that if we've got an uptick for demand, that we know that that resource is going to be needed coming. I'll be interested in understanding a little bit about that. And I am concerned about the phrase a continuing spike, in A&E referrals for self-harm, and a continuing spike is, I think, axiomatically not a spike. It's then become a trend. If it is coming down, I'll be very, very happy. And Alison is nodding that it's coming down, so I will. It's an elongated spike is perhaps reassuring rather than a trend. Thank you. So just a few comments from me. Anybody else like to contribute? Lisa.
Just where we're clarifying that the sort of stats and details are not to undermine at all what's been presented, because I think is absolutely right. Just in terms of knife and violent crime in Somerset, where we have been quite high in youth harm in the last 12 months, that's significantly reduced. But it does speak to the bit that Heather was talking about in terms of when we've had a crisis, as it really was, we respond very proactively to the thing in hand. When we have brought that sort of youth street violence down considerably, the exploitation though is still very real. So just to support, because Claire obviously mentioned that I was picking up on the exploitation bit being in the room, the threat we have is every measure of violent crime for children has come down over 12 months, except the risk of exploitation around drugs. So, you know, I'm really open to coming around the table, particularly in the families first agenda, to say, where is it now that we get in that early intervention space? Because the exploitation bit is the real concern for police.
I was just going to say, if it feels like we're kind of winding up to the popcorn stopping to pop in the conversation, and I'm just wondering, what are we going to put on our action tracker for what we do next? Because of this, there's clearly some work happening already, so I don't want to reuse that. But this has been a really good discussion, I think. So what are we going to do next as a result? Do we all get in a room in January and talk about this, but doing things, not just talking about it? I want something on the action tracker.
Claire.
Yeah, I was just going to say, in response to what Lisa was saying, that I understand the issues about serious crime coming down, which is brilliant for young people. My concern is that real continuation of young people involved in exploitation, and you can see that those young people involved in exploitation, some of them come into the care system, and again it all leads back to education. The significant proportion of them are not in school, on part-time timetables, etc., persistently absent. So the value of education in just protecting those children from people who are going to be able to exploit them. It takes 6-8 hours out of the day when those people can't get to those young people because they're in school. And if those children are thriving in school, they're seeing there is a different and better future.
Okay, thank you. Liz.
I just wanted to raise something that was in the forward plan, but that we've not, the action plan that we've not, it's the Get Somerset Working Plan under the Great Britain, Get Britain Working. And I just wonder if we're not missing a trick by not joining up with that work of that plan, because although that will be looking at young people who've finished education, maybe too early, but there's for me a really clear overlap here that maybe we need to be opening the door to the work of the Get Somerset Working Plan and just see how they overlap, because I you know, there are people who are bringing money into households without doing what we would call traditional work. And you know, as part of that economy, the drug economy is a very, very significant part of the economy. And as Claire has already mentioned, young people bringing money into a household that is going to do them and plenty of other people nothing but harm.
Absolutely. And I would just say, although we've been focusing on children's, because this was the Children's Safeguarding Partnership item, but it's families, isn't it? So if you've got a child at school, the parent can go to work, or if the parent's going to work, it's great the child's in school. I mean, all that stuff has to work together. So I think, yeah, let's not get, we can't look in silos. We're looking at families and looking at people. And you're right, obviously, ultimately, those kids become adults anyway. So what they learn early doors is most important. But I agree, couldn't agree more.
Just come back, because we have got the Get Britain Working. I hate those 3 words. I think they're hideous. but it's here as a closed item. I think it needs to shoot back up to an open item and ensure that we are working across every part of this council and the health services for Somerset. Get it back into the open actions if possible, please.
Okay, are we happy to take that away? Yeah. Yep. Done. Okay. And Lisa. It's contagious.
Thank you. Just to pick up then on Heather's request, what is our clear action for next time? Because for me, it feels like Duncan suggested that we have some data. We can all sit here and know some of the estates where getting in really early would really help us. Pre-birth, education, into school, tracking. We need the data to tell us where are our 5 top concerning areas of intense family scrutiny. We probably could name it now, but we need that in January with a plan as to what we're going to do in terms of vulnerably track, whether we're going to talk about education, whether we're going to talk about poverty, whether we're going to talk about preventing exploitation or labelling it all together, which would be my preference. You know, I would like a very tactical action from this meeting as to what we're going to do in January.
I was looking at everyone else as much as they were all looking at me. I've got to be honest.
Everyone's looking at everybody else, which is the whole purpose of this board is to avoid that, everybody looking at everybody else. Duncan has decided to step forward. Well done, Duncan.
I think the key thing we need to understand is the purpose of coming together of this board is to actually make sure we're taking the actions. The board itself is not taking the actions. So if we get some data, we understand what's going on, we can maybe try and, I pick up Liz's point about get Somerset working, about joining things up, making sure everything's embedded and linking up properly. That's where we got some value. We still need individual organisations to be able to say, well, actually, you know, I'd love to do this thing, but something's holding me back in the system. What can you do collectively to remove those barriers and allow me to do this? Or I'm going to do this thing. How can you help me target it better to get better outcomes? So I think it's quite difficult to say, you know, we will do this, but, you know, if it was an activity where actually, pick Lisa's point about difficulty states, if we need it collectively to get some cover to do some intervention work, then actually that's a really useful conversation to be had, but only if someone was prepared to do the work with that cover. If we're actually commissioning work effectively from this group, I think it's a different conversation that we're having. So we do need to understand what we're setting up if we have a conversation in January. What does that look like? You know, is there a proposition that we're talking about? How do we help it get delivered? Or are we sitting down trying to work out a proposition which probably starts to make me feel more less comfortable? Because I'm not sure that's what this board would be best at doing.
Thank you, and thanks for the clarity on that one, because that does help massively, Duncan. What I'm thinking of is, can we say that a representative from each of the organisations that are represented here will take away an action from today to say they will go back and seek that strength base and seek that the data, and then bring that to a meeting, which is like almost a task and finish working group, just to sit in a room. This is share the data beforehand. This is the data we've got. This is the way we could possibly problem solve this, or what things we could do. Just scope some ideas with us to make some actions, and then we report that back to the Somerset board about what the other people have done. I'm just trying to get people to get into a room with the data, which without falling over what, because you're right, this is a strategic assurance board. It's not a doing board, but can we not do that? Or Alice has got a better idea, which is great. I'm just trying to get some people in a room with info.
Yeah, I'm less responding to Lisa's point about serious knife crime and estates, because I think you're better placed to talk about that. But I think the discussion in December between a number of partners will start discussing how we respond to challenging situations, maybe not around crime, but around best start in life, family hubs, and engaging with parents right from the beginning. I really strongly feel like us trying to add another layer, looking at data, is not a good solution. We're not the right people. It should be operational services. So I don't know how to take forward the knife crime, but I think one action was the child poverty, just audit of, are we doing the right things that work to impact? So that would be one action I think we should take forward. But I don't think we've solved the how we're going to take forward the difficult estates, different working.
Sorry, I probably wasn't very clear. I didn't at all, didn't talk me. I was talking about the poverty-based data that we have that will talk to us where we already know that, and actually the latest SSP data that Lucy's going to supply to us, I think this week actually, will show us where our, we could lay over that hotspotting, your hotspotting from the Drug and Alcohol Partnership. We've got enough hotspotting to say where are our red areas of poverty, which then speaks to everything that Claire spoke about around targeting the intervention. So yes, this meeting is not going to commission the tactical element of that, but it does, it holds I think the responsibility to say all that data is available. What return should we have in the March meeting to show that we've used all of that to target? Because it feels like if we target the poverty red bits by overlaying those sort of 3 or 4 key bits that we already have, we can have a bit more of a plan by March as to what we're doing to speak to poverty and education.
Gerald.
Yeah, Gerald Taylor from Devon and Somerset Fire and Rescue Service. Thank you so much so far for all that the information around child poverty. It's been, a hard listen in some ways. And I've been making notes about what we could potentially do. And already one of the joys of being online is I can secretly go away and sort of put some actions in play. So I have done that, but it's about how do I log that? How do I share the fact that there are some perhaps more operational and tactical actions to see what we can do as a fire and rescue service and feed that back into the system, so you're aware of that activity.
I think that was, Lisa's comments really helpful. I mean, if we could trawl data, not by creating anything new, but just putting together what we all know already, maybe have a short form meeting of a smaller group, just after Christmas, pick up on what happens at the meeting that Alison's mentioned, that a number of partners have been involved in. I think the question that we should be asking as a group is, okay, if we all know what those hotspots are, if we all know what this looks like, whether we've consciously put that together or not before, I'm sure we have, but if that's the picture, what are we doing about it? That's the question we should be asking. We're not the commissioners of individual organisation activity, but if what's actually coming out is saying very, very clearly, I'm making this up, but these 5 areas have got all of those hotspots, co-locating within them, then the question we should be asking as a board is, okay, so what are we as agencies collectively doing to try and target that? Are we joining it up? And start to have some idea of framework that says, well, look, if we've got intervention coming forward that's dealing with a bit of this, but it's not in those areas, it's probably not right. And just make sure we're holding ourselves to account. And I think that's probably the useful role that this board plays more than anything else, is to actually make sure from what we all know, we're actually going away and doing something about it. And it may well be in a couple of those areas, some really good partnerships, multi-agency partnerships doing work together. But I suspect in lots of areas, what we'll find is that it's lots of individual agencies who might be working in a multi-agency way, but we're not really joining up the activity at the ground floor.
I wasn't sure whether I'm allowed to speak as an observer, but I'll give it a go.
The more ideas, the better.
I'm just wondering, rather than putting in another meeting, whether we look at the December meeting, look at the invite list, pull all the data into that meeting and take that as an opportunity to kind of kickstart this rather than waiting until another meeting comes along. Yep. Consolidate it, because that should be the subject of the conversation, shouldn't it?
The thing that's missing for me, and maybe it's because we all hold it in our heads, but we're just not articulating it, is what are we trying to achieve? I think if we had absolute clarity about what dial we want to move and by how much and by when, and we're really clear about that being the motivation for what it is that happens, we might avoid what I think we probably have at the moment. We've got it's clear there's a lot of activity, but a lot of activity does not necessarily indicate that you're going to progress anything. And I think we need to look at what it is in terms of what our ambition is in this realm to achieve and be quite forensic in terms of what it is that the activity as it's currently described actually contributes to achieving that. And as Duncan says, then try to work out what's missing if we're not getting confidence that that is what we're going to see. Because I think with any complex set of issues as we've got here, there is a risk that you come around it and you have some really good conversations and you put in place a whole load of things that seem really rich and good, but there's this fundamental chance that you come back in 5 years' time and not necessarily a lot has actually really changed in terms of the bigger picture. So I think it'd be really helpful for us to be really clear about what it is that we want to achieve.
Okay, I'm got to a point where I'm not sure what the next step is. I'd like to see something in an action log, but I'm not quite certain what it might look like. Could someone help me? Heather.
I was just wondering whether, because I'm really excited about the thought of this December meeting, and I don't like creating other meetings or other layers or whatever. Is that something that other meeting there could set us for as a system, or has that got a completely different view?
It's hosted by the chair of Somerset Foundation Trust, and there's a national speaker. So I think potentially slotting our agenda into their agenda. I think we can align them, but we can't take over the agenda. So it might be a bit of a challenge. But Bill, you asked us what we're trying to achieve. I think it's recognising the impact of poverty on our population and making sure we see where that's concentrated and maybe work in a different way in those geographies and make sure our teams are working in a different way to mitigate the impacts of that. Because we can't change national policy, but we can try and mitigate against the impacts on our families and children.
Okay, are we happy with that as a conclusion?
Yeah, I think if you look at the action would be that we take an item at some point then and take points about extra meetings, and the meeting Alison is just referenced, and say actually, so if that joins up, you know, what we want is conversation with all the agencies that are involved in one of our meetings. So, okay, so what's that looking like? And if the data has, you know, we can do the hot spotting as suggested, but if the data actually got some timeline to it as well, we can actually start to see what has improved, what hasn't improved. Because yeah, I think we're all heartened by the changes in knife crime and so on, but some of the poverty data is really, really stubborn. It's intergenerational in some places, and therefore, you know, I think it's just something we want on our radar to keep coming back to and saying, okay, so with everything we're all doing, is it making a difference? And if not, that should be a spur to all of us to do different, to do better.
Yeah, apologies for maybe throwing something. I've been wrestling with this in what is relevant to take back to the 270 city, town and parish councils. And I think there's two ways of looking at it. There is the intergenerational connectedness between young people's issues and parents' issues, and then grandparents' issues, etc., which the family hubs and through the Connect Somerset Championship are very much targeted at addressing. I would argue the board should be thinking about what metrics are there KPIs we can be looking at an early stage, recognising they're quite early in the launch phase, to say these are looking like they are working. I'm aware that some of the 13 or so that they are, some of them are working in different ways to others, like local community networks, which are place-based, are working in different ways to others. Are there ways we can strategically look at those rather than diving down into the detail? I'm actually, on the place-based side, I'm incredibly nervous about the, let's find the 5 areas where we know there's a big problem, because super output areas don't work in the vast majority of rural Somerset. That our issues are every town and parish has small pockets of deprivation, and they are the things that the family hubs are targeting. So to take something back that would be relevant that the parishes could help with. I'm actually more interested in the housing side. So if there was a real housing need to say, could we have a call for everywhere, in, like what you know your parish, are there spare properties? We all know that we've got a shortage of social housing places and private rental places in much of the county. Is there something that could be just directed to us that we could sensitively work with a group of people on? Like, because we can't do anything about the family hub stuff. I'm just interested in the strategic measurement of it.
Yeah, we have called for landlords, and I think we could make it louder, call for people, property owners. I mean, we do have an empty homes officer in the council who looks at properties or looks for properties that are empty. We are trying to bring forward our council homes, which sadly, when they are left empty, do come back to us in a very poor state. It's something I've been quite keen to work on. There's one in my parish that's been empty for 2 years. It's just coming back on stream now, but you know, they shouldn't be in such a bad state that it takes that long to get back to the market. So we're trying to work on those. But actually, yes, there are properties. I mean, sadly, we don't live in a county where there are lots of big private houses that would make ideal conversions. And those are the sort of things, or, you know, office blocks are being converted, like the one across the road here, to and indeed Block C we hope is going to be converted into flat use. But it's those type of existing properties. The quick result is something that already exists, really, rather than building from scratch, which of course is in the local plan and will be coming forwards. So what we're looking for is people who've got property who are interested in supporting our people in Somerset, bringing it forward. And you know, an empty care homes, anything that's got, you know, facilities within it, preferably ensuite facilities, are very useful to us if they can be brought forward for our use.
Lisa.
Yes, thank you. Speaking to the point about strategic KPIs, really, I think this is where the board can, circling right back to the conversation at the beginning, where the board can help us here, because if and when we align the vulnerability themes and identify what it is we're trying to sort, you know, the KPIs, when we think about what Claire has told us this morning, we will all want to see something different in getting children into education, because that means all of the things in their immediacy, but their plan for life is going to be a KPI, therefore, for adults, policing and everything else. So I do really commend that we commission a set of strategic vulnerability based KPIs which would make efficient all of those, because there are tens and tens of KPIs in each of our boards, our panels, and they all overlap. And I think, speaking to the gentleman who absolutely wants that, I don't want a super output area response. I use it as an example, and apologies for that, but definitely strategic KPIs is something that I think we need to sit here. But you probably need us to report back in as a group of vulnerability leads as to what it is that we think overlap.
Okay, I'm just noticed the Claire's fallen off the call, which I was gonna revert back to her at that point. Heather, did you want to?
Only to say thank you so much. I think I'm really grateful to Claire for bringing one slide with so much stuff on it, rather than, you know, we've read the background and we've read the presentations, you know, we've done the work before we got here. So I'm really grateful for that, because I think the quality of the debate that's come from here has been really useful. And I think the focus on doing things, you know, I mean, I'm not obsessed about doing things, but I am obsessed about doing things in some ways. So I'm really pleased with that. So I think I think we know what's going on the action tracker now, and that's a really good point to probably say that, yeah, let's take it away as an action, and we will use this forum to actually review how well we've done in our composite parts of our system.
Yes.
Just a thought regarding parish, town, city councils. Is there a kind of known list of those councils who are funding youth work within their boundary? Because I just thought, if there isn't, that would be a really good starting point, so that we actually understand where that work is going on, and where there are gaps, and then do a gentle mapping exercise. I understand about the super output areas not being ideal, and the fact that poverty is kind of everywhere and often hidden, particularly in rural areas, it's hidden. But I just thought there need to be some practical things that we can, each of us, go out and do and then bring back together and actually have a look at where we can work better together when we know what each other is doing.
Yeah, we do have a known list, and we are engaging with Spark, or relevant people at Spark, on like how to take this forward, because there are more parishes that would like to get involved in youth work. So we're trying to work out how best to serve that. If there were other people who should be involved in that conversation, very happy to follow up outside.
Yeah, that's. I'm sorry. I'm just trying to resolve. I think I'm on my 6th microphone now. Yeah, indeed. So apologies as to where that has gone, but just on whether the Youth Work Alliance has got that information, and certainly, what I was very impressed by the Hestercombe LCN that have gathered together contributions from all the parishes, and then got a matching fund contribution as well to be able to fund their youth work across a wider geography, and that's a model that could be looked at as well. I've got Angela and Catherine online. Angela first.
Thank you. Very quickly to update that we have got for 3 years a crisis and resilience fund coming into Somerset, and that will give us an opportunity to do a lot more prevent work, as well as the existing work we currently have underway through Household Support Fund. And something we might like to feed into the system to look at is over the next 3 years whether our discretionary housing payments and council tax reduction policies could line up around a prioritisation for families at risk of homelessness or housing insecurity, where there are children who would suffer detriment. So I would feed that into the data we look at. So it's really positive that we've got that 3-year programme. It is focused on wraparound support for the whole individual or family household. But just to caution, we've also got renters reform coming through, and we are anecdotally already aware of landlords coming out of private rented sector. So we've got some good news on the horizon, but we've also got a bit of a challenge through that legislative change. Thank you.
Thank you. And we'll know the impact on the private rented sector of hosting the largest construction project in Europe as well. Catherine.
Yeah, just a couple of quick points. So it was really just to let you know that the Youth Alliance, when it kind of began a year or so ago, was very much some youth work organisations. But what we've done is we've extended the reach now, so it's any organisation that's working with young people using youth work principles. So that means this kind of wraparound, more holistic approach is something that we're able to do. So it means that the membership of the alliance is going to be much bigger. And then the other point was just to say that absolutely we're in conversation with SALC and with Ewan. We went to the recent SALC conference, and I think for us this does have to be a very place-based approach, because what we're finding is that there are a number of areas that are hugely supportive and understand the principles of youth work, and then there are some areas that don't. So there is a bit of an education piece here as well. So we're taking a different approach in each area, and also looking at where the really good examples are, and showcasing those, I guess, to the town and parish councils who haven't yet invested. Because as I say, I think there is a piece of work to do really around demonstrating why it is a really good thing and why it is a responsibility of town and parish councils to consider funding and supporting youth work in their area. But yeah, very much ongoing, and we're working really closely with SALC.
Thank you, Catherine. Are we all done on this item? Thank you so much. been a really thought-provoking conversation, and lots of thoughts and ideas coming to the table. And good to see that we've got something to move forwards with. So thank you so much for everybody for contributing on that one. And we go on to item 8, which is our SRO updates. Rizal?
Thank you, Chair. Apologies, I'll steal your microphone. So yes, this was just a quick update from my perspective in terms of we did convene the working group that we asked that we would form as part of the last meeting. These are just some just brief updates on that activity that working group's been doing. It will be reporting back again in March as well in that meeting, and potentially some interim things as well in terms of its reports and its findings. This is just a summary of suggested improvement activity that we've recognised for the board. So part of that working group activity, your members will be aware, is to try and align the board with what it needs to be moving forward, certainly in terms of the impacts of the 10-year plan coming out of the NHS, but also just as the system in general is in a bit of flux and shifts. As the conversations today have also alluded to, there's a nod towards more of a thematic approach for Somerset Board moving forward, rather than being fed reports on an annual basis and things like that. Actually, we have a much more of a thematic approach to meeting and a task and finish approach. Alongside that is also the recognition that the broader partnership system is in flux, and there's new boards forming, there's boards joining, there's also partnerships that are delivering various aspects of what we would regard as the improving lives strategy as well. So we're continuing to map out what all those key partnerships are, the housing partnership and as well as the economic growth board, and in delivering that Get Somerset working plan, as well as Connect to Work as well. So I've visited the economic growth board and started to make those links with them, and it is expected, their understanding that there is an expectation that we get an update on that Get Somerset working and on that Get Connect to Work as well. So linking in with those partnerships where we can for that assurance and that accountability, but also seeking to drive them and steer when they are renewing their strategies as well. In terms of the structure, again, the structuring of the board and making sure that we're meeting when we should be meeting, the need for more meetings without it being necessarily formal meetings and being a bit more dynamic maybe on the membership as well ties into this. So hopefully you'll start to recognise some of the things we're recommending in here, some degree or suggesting at the moment rather than formal recommendation are in keeping with the conversations we've had today about need to be much more delivery based, need for the agendas themselves to be more thematic, and that the structure and the membership of the board needs to be a bit more fluid and a bit more dynamic, and certainly be more impactful was the key takeaway we had as well, was that the Somerset board needs to avoid discussing things for the sake of discussing things, and actually it is targeted discussions that lead to impact and delivery in that regard. So that's a quick slide on that. And in terms of how we think we will look like when we get there, so a nod towards eventual objectives and measures and KPIs and things like that, but not necessarily fully there from my perspective. That this is almost what I'm working to as the board manager, is to say I'm hoping that Somerset board starts to reflect some of the items listed here. I won't go verbatim through the slides, not least because I don't know how long this microphone's going to work for, and I won't be able to be able to have a microphone back. But I suppose I just wanted to give the board a bit of an assurance that the working group is meeting. It is very active at the moment, and it is discussing a lot of topics. A lot of those topics have been reflected today in conversations as well. So we'll take that forward. We'll seek to not only improve this board and the way it runs and how it clicks together with other boards and partnerships, but also we'll seek to make sure that we are timely in our discussions and that we reflect the fact that there are discussions taking elsewhere and other steers happening. I'll give way then, Chair, if I can.
Thank you, Liz.
Oh, that's not working.
Try this one.
Oh, yeah.
Mine's now gone on, weirdly.
Okay.
Thank you. Chair, I just want to raise that once we get past 1st of April next year, we will be through all of our work on the revenues and benefits system. We'll all be on one piece of software then, and we're making really good progress. Don't, don't worry, but it is going to be some time before we're able to interrogate everything and work in a preventative way using the data we have from revenues and benefits. So I just want you to be sure that you include the revenues and benefits team at the right time, which is not today, but at the right time, and ensure that they are one of the partners who can contribute to the work that Somerset Board wishes to oversee. Thank you.
Thank you. Anything else on the update on the working group activity? Not seeing anybody. So do we have David?
No.
No. So do we have an update on the JFP?
Apologies, no. I'm not sure where David is. I've contacted his PA, but she can't seem to get hold of him.
Bernie's gonna step in. It depends on the microphone.
But I've got somewhat of an update. So David has been in contact with me. Unfortunately, he hasn't been able to come to the meeting today because he's not very well. I can read out what he's sent to me by way of an update, if that's helpful. New guidance dropped last week. I'm reading literally what he's saying. New guidance dropped last week, which now supersedes the slides that have been presented. The ICB is progressing its plan to develop both a strategic commissioning plan by mid-February and neighbourhood health plan by end of March. Health and wellbeing boards do have a role in the neighbourhood health plan submission by the end of March. We don't yet have guidance on what that should contain. Moving to neighbourhood health is the golden thread that runs through all our plans, and we're therefore keen to co-produce that plan during the first quarter of next year. Plans around that co-production are just being worked up. There's an obvious unknown around how much of the plan will be at cluster and how much will be at place, but again, we should know more about that in January. And yeah, I mean, what David is saying is I think would be recognised by many of us in the room. So there's been many carts before many horses during this planning round, and I'm not sure that all the horses and the carts necessarily match, but that's what we're working on, and we are busily getting the horses in front, and more to follow.
That one. That one looks like it's working.
See, having someone who is red, green colourblind trying to interpret whether mics work is not to be recommended. That was really useful. So if there's a need for a neighbourhood health plan submission by the end of March, should we plan to convene the neighbourhood work stream some early in the new year?
That sounds really sensible. So I'll take that away for
Okay, Alison.
Yeah, I don't want to speak for Rish, but I think we've got a workshop planned as Somerset Board for January, and we were going to propose neighbourhood.
Okay.
Would that be okay?
That's superb.
The second bit I was going to suggest is also with the strategic commissioning work you've got to do, the cluster is going to take that and produce a cluster population health plan. So we're going to be busy people. If we want to influence the new cluster, we need to make sure the outcomes that are important for our population are captured in that strategic commissioning plan. So any guidance from NHS colleagues as to how we can do that most effectively would be really helpful.
Okay. Just conscious of the that we're approaching the cut-off point for the meeting, and I think we've got one other. David, have we? No. No, that's the same. We've covered that update as well. Is there anything else anyone wants to raise? Colleagues, thank you so much for all your contribution. It's been a fascinating meeting, and really do appreciate everyone's input today. And declare the meeting closed. We will see each other for a workshop in January, and our next meeting is at the end of March, 31st of March, back here in the electoral room. Thank you very much, everybody.